Hi everyone, welcome back. Remember, if it's your first time to my channel, please like, share, and subscribe. So when I first met you all back in December, I shared with you that I was an occupational therapist and a certified diabetes care and education specialist. And many of you, like most people I encounter, have no idea what occupational therapy is. So today I'm excited to share how my dual certification as both an occupational therapist and a certified diabetes care and education specialist creates a unique approach to helping my clients thrive with diabetes. So let's get started. Again, many people don't immediately see the connection between occupational therapy and diabetes management, but they're actually a perfect complement. And I'm going to tell you why today. So stay tuned. So I'm going to give you some client examples. And please note, I'm not using real names, so I'm not compromising any information. Okay, so let me explain the connection. Connection number one, daily living activities and glucose management. As an occupational therapist, I'm trained to help people of all ages participate in meaningful daily activities, despite challenges that they may have. This can include anything from self-care tasks, work, leisure activities, and even home management tasks. OT focuses on improving independence, function, and overall well-being. As a certified diabetes care and education specialist, I understand how those activities directly impact blood glucose management. In the first client example, I'm going to talk about Sarah. Sarah is a 62-year-old artist with type 2 diabetes who struggled with her morning routine. Her blood sugar readings were consistently high before lunch. When I visited Sarah's home, I noticed that her medication was stored in her bedroom, but she took it after preparing breakfast in the kitchen. By analyzing her morning occupations through an OT lens, we restructured her routine to include medication with her kitchen activities. We created a dedicated medication station next to her coffee maker because she didn't go a day without her coffee. Within 2 weeks, her pre-lunch numbers improved dramatically because she no longer occasionally forgot her medication. Using my ability to analyze tasks and daily routines, we were able to come up with a solution that worked for her. Connection number two, adaptations for diabetes complications. Diabetes can cause neuropathy, vision changes, and other physical limitations in some of my clients. As an occupational therapist, I specialize in activity modifications and adaptive equipment. As a certified diabetes care and education specialist, I understand how these complications relate to glucose management. John, who's a 45-year-old construction worker with diabetic neuropathy, meaning he has some numbness and tingling in his hands, was struggling with glucose monitoring. The numbness in his fingers made it difficult to use his meter, and he was checking his blood sugars less often. So rather than just emphasizing the importance of monitoring, I evaluated multiple glucose monitoring devices from an OT perspective, considering his specific hand function and his specific limitations, as well as his outdoor physical work, his preferences, and the financial considerations. We found a meter with a larger grip and easier strip insertion, and I taught him how modified techniques could work and accommodate his neuropathy. His monitoring frequency increased, giving him the data that he needed to be able to manage his diabetes better. Connection number three, habits and routines. Occupational therapists are experts in behavior modification and habit formation. That's what we do. Diabetes management is ultimately about sustainable habits and behavior change. In the next client example, I'm going to tell you about Maya. She's a busy 38-year-old executive with newly diagnosed type 1 diabetes, and she was really overwhelmed by her treatment plan. Instead of just educating Maya on diabetes, I used OT habit formation and techniques to work with her. We created a list of Maya's current habits and routines, and then tied new diabetes tasks to her existing strong habits. Her glucose checking was paired with her morning coffee ritual, and her carb counting was integrated into her existing meal prep routine. 6 months later, these diabetes management tasks have become automatic parts of Maya's day. Connection number 4, addressing mental health. Both diabetes management and daily functioning are heavily impacted by stress and anxiety. David, my 70-year-old retiree who was extremely anxious about low blood sugars to the point where he was limiting his social activities. He stopped playing golf with friends due to fear of frequent lows. Using cognitive behavioral techniques from my OT training combined with diabetes-specific knowledge, we created graduated exposure of activities. We started with short walks near his home, and we had our hypoglycemic treatment supplies, and we were able to gradually build to the golf course with proper snacks and proper timing and adjusted insulin. We also implemented the use of a continuous glucose monitor, and I helped David set up the device to his phone and make sure that he could identify trends and properly use it. Now, David's back to the course weekly with properly managed glucose and significantly reduced anxiety. He is loving his CGM and he is back to being his social self. So, in closing, what I want you to take away is these examples really show why combining occupational therapy and diabetes education can create such powerful outcomes for clients. I'm not just helping people manage their numbers, I'm helping them integrate diabetes management into everyday life. And I'm doing what I absolutely love to do. If you're living with diabetes or you know someone who is, consider how an occupational therapist like me with diabetes expertise might offer a different perspective on your challenges. If you're an occupational therapist or a future occupational therapist, I want you to think about the impact you make every day and how specializing in diabetes management can continue to help your clients across the lifespan. Again, thank you for watching. If you found this helpful, please remember to share. And please remember to like, share, and subscribe. And then drop any questions in the comments below. I would love to see what you have to ask me, and I would love to see what you want to hear about next. Again, thanks for tuning in, and I'll see you in 2 weeks. Not 1, but 2 weeks. So thanks, everyone. Don't forget to like, share, and subscribe.